Hello and welcome to Digital Medboard. Here we go. The given image is the left femur bone. The gluteal tuberosity is located on the posterior side of the femur and serves as the insertion site for the gluteus maximus muscle. The head of the femur is located medially and the lesser trochanter is located posteriorly. We are observing the right gluteus maximus muscle. Approximately 25% of muscle fibers insert on the gluteal tuberosity of the femur. The remaining 75% of fibers continue into the iliotibial tract, blend with the tensor fasciae latae, eventually attaching to Gluteus tubercle on the anterior aspect of the tibia. This insertion helps stabilize the knee joint, particularly during extension. The gluteus maximus passes posteriorly to the hip joint and primarily functions as a hip extensor and lateral rotator. According to Gray's anatomy, it also acts as an abductor. The upper fibers of the gluteus maximus assist in abduction by pulling the femur away from the midline, while the lower fibers contribute to lateral rotation. Additionally, the gluteus maximus muscle acts as an antagonist to the iliopsoas muscle. The iliopsoas muscle, located anteriorly, and functions as a hip flexor by pulling the femur forward. Gluteus maximus functions in order. At first, extension of the hip. Next, lateral rotation of the hip. Then, abduction of the hip. And finally, knee stabilization via the iliotibial tract. We got a question. Mention action of the muscle on hip joint as marked in the diagram. This is a controversial question. The marked structure is the gluteal tuberosity, the insertion site for the gluteus maximus muscle. Based on the discussed functions of the gluteus maximus, both option A and option B can be answers. But according to the order of primary function, option B is the correct answer. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose.